My name is Michelle Dugan. I'm a clinical research fellow at Moffitt Cancer Center, and I'm here at SSO 2025 presenting our work on the impact of sentinel lymph node biopsy on recurrence and survival for Merkel cell carcinoma. So Merkel cell carcinoma is a rare cutaneous malignancy that carries a poor prognosis in advanced stages. Sentinel lymph node biopsy at the time of excision is standard of care, but the impact of sentinel lymph node biopsy on survival is unclear. This study examines the impact of sentinel lymph node biopsy on recurrence and overall survival outcomes for patients with Merkel cell carcinoma. We performed a retrospective review of patients from 1999 to 2024 with resectable Merkel cell carcinoma without clinical evidence of nodal disease. We identified 696 patients with a median age of 76 years. 75% of patients underwent a sentinel lymph node biopsy, with 35% of sentinel lymph nodes being positive. The most common reason for omission of sentinel lymph node biopsy was patient comorbidities, which often prevented them from being able to safely undergo general anesthesia. Other common reasons included patient choice and negative lymphoscintigraphy. We found that recurrence-free survival for patients who underwent sentinel lymph node biopsy was significantly higher than those who did not undergo sentinel lymph node biopsy. Similarly, we found that the disease-specific survival for patients who underwent sentinel lymph node biopsy was higher than those who did not. And we found that overall survival was also higher in patients who underwent sentinel lymph node biopsy compared to those who did not. We also found that recurrence-free survival for patients with negative sentinel lymph node biopsy was significantly higher than those with a positive sentinel lymph node biopsy. When looking at Merkel cell polyomavirus status, patients with tumors that were positive for the polyomavirus had significantly higher disease-specific survival than those who had negative polyomavirus status. On multivariable analysis, recurrence-free survival, disease-specific survival, and overall survival all remained significantly higher for patients who had a sentinel lymph node biopsy. And recurrence-free survival and disease-specific survival remained significantly higher for patients with a negative sentinel lymph node biopsy compared to those with a positive sentinel lymph node biopsy. So in conclusion, patients who had a sentinel lymph node biopsy had better outcomes than those who did not. Patients with a positive sentinel lymph node had worse outcomes than those with a negative sentinel lymph node biopsy. And polyomavirus positivity was associated with better outcomes. Thank you very much.